Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hey everyone, Michael Reynolds here from the Massage Therapy Foundation. Welcome back to Research Perch. This is the podcast that unpacks articles from the International Journal of Therapeutic Massage and Bodywork at ijtmb.org and brings them to life for you, our listener. I'm here with, as always, Nikki Monk and Ruth Werner. Ruth, where are you joining us from today? You're out and about.
I am. I'm in Washington, D.C. this week, so I'm really happy that we managed the technical obstacles to make this happen.
Yeah, sounds great. From one end of the country to the other. So
that's right.
Hope you escape the incoming weather there. And Nikki, how are you today?
It's crazy busy, and so pleased to have this fun time.
Good. I'm so glad. All right. Well, let's get started. So today we are discussing an article titled "Negotiating Consent: Exploring Ethical Issues When Therapeutic Massage Bodywork Practitioners Are Trained in Multiple Therapies." So, wow, that took a long time just to say the headline there. So, I know that there's a lot of discussion to happen here. So, Ruth, you had mentioned before we started that you had some thoughts to kick us off with. Would you like to start?
Well, I'll begin it, and I'm sure that Nikki can back me up by talking about some of the aspects of the way this research was done. But basically, the premise is that many massage therapists are trained in lots of different modalities. And when they get permission from their client to begin a session, it can happen that maybe they haven't explained all the modalities that they end up wanting to use during the session, or maybe they need to change their strategies because something has come up. And so this is a paper about how massage therapists generally obtain permission to do the work that they do from our clients, and some of the ethical fine-tuning and nuance that has to happen when we need to maybe renegotiate that consent mid-session. Nikki, would you say that that's a decent sort of overview of what we're talking about here?
Yes, and let's back up just a little bit and talk briefly about what consent is.
Yes.
And why it's important. And so there's a couple of things to articulate. One is, because we're talking about a research study, there's a difference between informed consent for research and informed consent for practice. And so we are talking about informed consent for practice. So who are the players in informed consent here? You've got the practitioner, and then you've got the client or the patient. And so in out in medicine, we inform consent all the time, right? Before our doctor comes in and does a procedure on us, we read all about this is the procedure that's going to be happening, here are the risks and benefits, do you give permission for this to happen? And it tends to be for per procedure. So this is a sort of a piece between patient and practitioner. So there's three things that the article does a really nice job highlighting what informed consent is and why it's important.
Yes, I appreciated this too.
Yeah, so this is nice. So I'm just going to read straight from here. Three things. One, that the patient be fully informed as to the proposed treatment, including its purpose, risks, and benefit. Two, that the patient is capable of understanding the information provided. Three, that the decision to undergo treatment is being made free from undue influence. So these are the three components, and all of these things is to basically promote patient or client autonomy, right? They're free to make these decisions, and they can make these decisions on their own. And so the thing that they are pointing out here is that as bodywork practitioners, when is informed consent given? What does it mean? How are we doing this? And then, like I mentioned in our example with medicine, for each procedure that we have done in medicine, we are informed what that procedure is. And then we get to sign off on it, if you will, and give that consent, that permission. And what do we know about therapeutic massage and bodywork? People tend to do multiple modalities. And at what point are we supposed to be getting, or are we supposed to be, and are we doing in practice getting those permissions? How does that look? Why? And so then it begs the question, why is this even important? How come? Why do we need to know this? And so we could talk on that level. We also want to come back around to talking about this in the context of the greater study of what they were doing. So now that we've laid the foundation of who are the players, what consent is, informed consent is, now let's talk about the so what. Why do we care, Ruth, in therapeutic massage and bodywork?
Right. Well, and of course we care for a lot of reasons. One is to maintain patient autonomy, so our clients have input into what happens and some kind of control over what happens to them and with them during a session. And the other, and there are other reasons in addition. It was interesting because I was involved in a conversation just yesterday, I think, about breast massage and how some states in the United States, it's specifically mandated that it's not within the scope, so it's not within that state law, and other states mandate that you need a signed informed consent to perform breast massage, and other states, don't have a regulation like that. And that's an example of a situation where you need to negotiate that permission, before you start working together. And we don't want to do that because it is a kind of thing that could be interpreted as threatening or inappropriately sexual or whatever. That's the kind of conversation that needs to happen before one person is naked on the table, right? It's the power differential and the knowledge differential in these relationships is very, very clear. The other thing, I think there's a huge ethical issue with informed consent, which is that this is when we explain to our patients or to our clients what we think we're going to do, and we ask them if that's okay. And one of the hottest topics that I see in our profession right now is how do we explain what we do if we don't know what we're doing, right? In other words, if we don't really understand the mechanics of what happens when we do petrissage, or why does someone feel relaxed after a massage? How can we get informed consent to do that? And that's why I really enjoyed reading this, because the language which this author did not make up, he pulled it from accepted definitions of informed consent, talks about describing the nature of the treatment and the risks and benefits. That's something that I think we can do with some realistic language, where we don't have to be making things up about what we think is really happening on a cellular level or an energetic level or whatever. So I feel like I maybe have talked myself down a dead end, but part of the informed consent conversation for me is that we want our clients to have as clear an idea as they want of what's about to happen, and we want our clients to feel free to say, no, I don't want that, stop it now, if something happens that they don't want.
So let's talk a little bit. We'll back up some, and so that's a great so what. These are all very important pieces. So now let's back up and talk about the actual study that was being done here, and then we'll jump to some of the results, some of their outcomes that they had.
Yeah.
And so this is part of a study, a larger study that was there. This group and Dr. Persino is part of this group, are looking at what is it that we do as therapeutic massage and bodywork. And so they have several different publications that are talking about these things. And this is a particular thing that as they started doing these interviews, they identified 19 different practitioners, I believe, and they were asking questions about the nature of bodywork, the nature of what it is that we do.
Right, and just to say, those 19 practitioners were chosen on purpose to represent a wide spectrum of ages and experience and practice settings.
Yes, absolutely. So they did a really nice job trying to be as representative as possible. And after the first couple of interviews that they did, where this idea of consent was coming up, they realized, oh, wait a minute, there's some additional questions here that we want to ask. And so they just added a couple of questions, and that was, when do you get consent, informed consent? And how do you do that with the different modalities? Because one of the things that we know, we do more than a technique. We do a series of techniques, and not only that, but sometimes within that umbrella of therapeutic massage and body work, they're doing things that may not be considered TMB, right? So they might be doing some TENS unit type things. Maybe they're trained in that, or they also do Reiki or some other kind of modality. And how does that flow?
Exercise recommendations,
right.
or yeah, all kinds of things could be thrown into under that umbrella, which was one of the metaphors that one of the people used.
Yes. And so here's the thing, and this is something that I want to point out about this particular study. This is a qualitative study, which is very different from the other studies that we've been talking about in Research Perch. We've talked about case reports. We've talked about survey research. We've talked about trial research. And these are answering very specific questions. But now imagine if you're trying to get at how do you negotiate consent. Is there a survey that you can develop that's going to be quick and easy to give, that's going to get at the questions that we're interested in? Not really. And so really the only way to get at this right now is to just go and ask people, well, how do you do that? Well, you develop some open-ended questions, which they've done, and you let people talk. And as they talk, then you ask them further probing questions. And then after you get everybody's response, then you start looking for themes. And you code what they've said, and you look for themes and start putting some of this information together so you can talk about it in an informed and a so what sort of way, right? So that's what they've done.
I want to say at this point, for our listeners who might not know, these interviews are recorded and transcribed, and then there's software that helps you look for those linguistic themes.
Mm-hmm.
So we can, as much as is possible, pull out the bias of what the interviewer wants to hear and really be paying attention to what the speaker actually says.
Right. And so the thing that they're trying to get at is, at what point is informed consent gathered? Mm-hmm. And then how is it negotiated throughout the different modalities or different techniques that are being applied in a single session? And so from the different interviews, they've come up with a few different themes where this falls under. And so one of these themes, I'll go ahead and say all three of them, and then we can come back and talk about them.
Good.
So one was people are compelled to engage in informed consent. So compelled, what does that mean? Because, well, I have a standard of practice here, and I've signed on to, for instance, the AMTA Code of Ethics that says I will get informed consent. So I do that. But
so I do it because I have to.
Right, I do it because I have to. Mm-hmm. And then there's another, so then when is that done? How is that done? And one of the big themes was I give them a general treatment goal. So we'll talk about that in just a little bit and what that sort of means and the implications of that. And then the other opportunity or the other way to do this is, would that be okay? And so that's the other umbrella theme that they talk about. So those are our three pieces. So let's start first with how is it done? I do it from a general treatment goal. So when you really start thinking about when do you get informed consent? Well, when the person comes in and sees me that first time, we talk about what it is that I do, potentially, right? And they sign a piece of paper that says, yes, I agree to have you do this. So, and from this, what is your goal? I want to be able to have freer range of motion, pain, I know what you do, go and do what you do.
And you have my permission to do that, right?
This sort of blanket permission to do it. So that's one piece. And they had some nice quotes that come out from this. So this is a quote from practitioner number 2. They're consenting to come in and allow me to manipulate their body. So, you know, whether I do it with Reiki, with massage, or with acupressure, I think it's not an issue. So this is a person who gets that blanket consent at the beginning for the outcome. But
well,
go ahead.
And I'll say that in the United States, I think this is probably the one that most of our listeners will connect to, you know, and in my own experience of this, you know, the way I think about this is I am, as a massage client or customer, I'm hiring this expert to help me achieve my goals. So, you know, you do what it takes to help me achieve those goals, and I'll tell you if I don't like it.
Right.
Yeah.
So then the discussion point comes, the discussion point of this now starts coming back, well, is that enough? Is it enough?
Right.
Is that okay? Is that giving the client and this person who's coming and getting on the table enough of the information? Do they know enough? Do we know enough about what we're doing to be able to say, these are the different pieces that I want to do this, that I'd like to include in our treatment? Do you consent to have all of these done in the order in which, you know, I deem in clinical judgment is?
And, you know, so, yeah, and where I run into an obstacle with that is it's not the client's job to know what myofascial release is, or neuromuscular therapy, or you know, any of the other 10 labels that I might list on my business card. So, you know, I think one of the there's a bit of a cultural issue here, which is that I think this is a Canadian study, and my experience of working with massage therapists from Canada is that there are much clearer divisions between modalities there, or understood modalities there, than we often talk about here, where we tend to maybe mishmash a lot more. And so, you know, what do you think, Nikki? I mean, do you think it sounds to me like you're building a case that we need to check in and get consent sort of more often? Am I misreading you?
You mean, oh, you know what? I don't think that's what I think.
Okay.
Because so here's the thing.
I love it when you say that.
What, here's the thing?
Yeah.
You know, so there's this piece of balance that I know I struggle with, and that is, this is the therapeutic environment and the therapeutic encounter that I am creating for this person, right? And you know, we might actually want to jump over into this other theme, which is the "would that be okay" theme.
Yeah. I think we're ready.
And so this is, and then we can come back to what I personally think, maybe, because I think this what this study does is it starts articulating places where we as a field need to start having this discussion, not just from our practice standpoint, but from our education standpoint, and how, you know, just understanding and articulating why it's important to have this consent, and being able to, as a profession, step back and go, this is what it means to get consent, and this is how we make sure that these 3 reasons are hit and taken into account. So we'll come back to that. But so the other umbrella is, would that be okay? And so I see this as, you know, perhaps a combination. So they come in, the fact that they have come and booked a massage with me, they have gotten on my table, they've signed the piece of paper, my intake form, that says I give permission for you to lay hands on my body and do massage. But there's also pieces in there that maybe fall outside of, okay, so I'm doing massage therapy, but I also have this other tool in my bag that maybe they didn't imply or get consent from, right? But I'd like to do this craniosacral work on you, for instance, or lymphatic drainage. And to be able to say, you know, I think this would really help you. Would you be okay with us doing this? And, you know, they could say yay or nay, right? But then the question comes up is, are they really in a position to say yay or nay? Because here, this is the third component, right, of informed consent, and that is agreeing to something without undue bias. So,
or undue pressure.
Pressure, right. And so, is there pressure? And in fact, one of the participants articulate this. How able is somebody to give consent for something when they are laying naked on a table under a sheet, where there's this power differential? And so, you know, that sort of, while there is I think a clear argument and discussion for, you know, this is sort of how things work in practice within this therapeutic environment that we set up for ourselves, potentially, that the would that be okay is sort of what happens in consent land. But is that appropriate? And is that okay?
Is it enough?
Yeah, is it enough? And, you know, I know from personal experience that, yeah, no, it's not. I know that there have been times when I have felt, and this was well before my first experiences with massage was actually kind of negative. from an informed consent perspective and from a practitioner professionalism perspective. And there were boundaries crossed. And it's like, well, was I able to give informed consent? No, probably not. I wasn't.
These kinds of oh, go ahead, Ruth. Sorry.
Well, I'm interested to hear your question on this, Michael, because we've been yakking, more than we usually do.
Oh, yak away. That's what we're here for.
Yeah. I'm just, one of the things I do is I teach an ethics class about what happens when you're mid-session and because of some health issue, because that's my filter. What happens when because of some health or disease issue, it's necessary to change tactics.
Mm-hmm.
Right? And because this happens to us mid-session all the time.
Yes.
And so it may be necessary to stop doing your deep tissue massage because you learned something about your client's status that makes you know that this is not in their best interest, even though that's what they may have signed off on.
Mm-hmm.
Right? So I'm really interested in this as an ethics issue because you're in the middle of the session. By default, your client is naked on the table with only a sheet on, and it is not in their best interest to continue along your original strategy. What do you have besides terminating the session to say,
would that be okay method? Yeah.
All you have is would that be okay? But if that's not enough,
mm-hmm.
We just don't have that many options.
Mm-hmm. Yeah.
My question was always, I'm always fascinated by kind of how the massage therapy profession fits in the bigger picture, because I'm always fascinated by this tug of war. You've got the massage therapy profession, and I feel like there's always one foot in the world of luxury services, spa treatments, kind of that world, and then also one foot in the medical community with actual treatments that address concerns and have a kind of a seat at the table in the wellness and the healthcare and the medical community. And so I always see massage therapy as a profession having like kind of a foot in both camps. And there's always this tug of war I see sometimes in the industry, which may or may not be a good or bad thing. It's just kind of what I've observed. And I'm always fascinated by that, kind of that concept and where we're shifting as an industry. And so I'm wondering if either of you feel like this discussion, which by the way is fascinating to me now. At first I read it and I was like, oh, so what? I didn't quite get it, but now my so what has turned into, wow, this is really fascinating and really important to have this discussion. Yeah. And so I'm wondering if either of you feel, or how you feel this discussion affects massage therapies as a profession, that seat at the medical community's table.
So maybe this is another way to ask that question.
I probably asked the question really poorly. I'm sorry.
No, but I'm just kind of sort of I don't know why I'm thinking, but is all consent created equal, or is there a need for consent in different ways in different situations? So because quite frankly, if I am going and getting a relaxation massage at a spa, I'm not really necessarily signing on to somebody talking to me very much in that. I'm going to sign off. I want to be able to just sign.
You want to zone out, relax, feel good, de-stress.
I want to completely zone out. Don't talk to me about anything. I don't want, you have permission if you, and so I don't want my consent renegotiated.
Right.
In that situation. But there again, there needs to be the client, the patient piece for that. So
well, and in a different sort of scenario, and it's interesting because this just happened to me. I do very, very little body work anymore, but as it happens, I was working with someone last night who's been having back spasms, and I asked him, has anyone ever talked to you about your psoas muscle? And he said, my what? So I described to him what I wanted to do to access his psoas, because I have a way to do it that's not painful, or it's intense but not painful. And I emphasized that if it gets to be painful or if he wants it to stop, he needs to tell me right away. But it was a great example of having of changing strategies in his best interest, because what I was doing wasn't working and I thought I had a better idea. But that's when you're working together on a project, right? You're working on goals together, as opposed to the project of moving you into stage 4 sleep. So.
But one of the things, too, that you've also established is you've established an environment and a framework for a continuing dialogue of negotiating consent. So that's what. So part of this might actually be a languaging thing too.
Mm-hmm.
Is that okay? So we read this and quickly understand what negotiating consent is, and this is from experience from the medical side and from the healthcare side and from research side, right? Consent and the importance of that. But is this something in these terms that is discussed on an education level, on a basic education level? And as we get into some of these other specialty trainings that we bring into our foundational work, is that a component that is taught? And so I can get on my bandwagon of education research right now, but I won't. But this is a place that in education we need to know what's being taught and is it effective? Because I would beg the question of, is informed consent to this level being taught in our foundation programs?
Right. Yeah, I have a hypothesis on an answer to that question.
What is your hypothesis?
It's fascinating, and I'm seeing in here the seeds of a new ethics class in development, because I think there's a lot to talk about here, and as a profession, we can afford to do a lot more peer supervision than we do, so we have a chance to share our experiences with each other in an appropriate and ethical way.
Yeah, I think so, and even do we need to, as organizations and groups, better articulate what we mean by we expect our people to be getting informed consent?
Right.
And saying what that means within the framework of what our profession looks like. And I really want to give a big shout out and commend these folks that are working on this. So Drs. Pacino and Page, Boone, and Verhoff.
Is Dr. Verhoff on this too?
Verhoff is, I believe, is the lead on this one, right? Did she lead this one?
Oh, I only took notes. I didn't print it out, so.
Okay, yeah, but she's in the senior author position, so I'm going to say that yes, you're author there. But I really want to commend the work that these folks are doing. It's important work, and it's work that nobody else is doing in our field, and it's vital.
Right.
I'm so pleased that this particular one was printed in the IJTMB, and that we have the opportunity to talk about it and break it down here. I'm big fans of this particular article and the other work that they're doing.
I'm glad we had a chance to really dig it out a little bit. It was a good one.
Yeah, I've actually found it fascinating. Like I said, I wasn't sure what to make of it at first, but this discussion has been really eye-opening for me and quite fascinating, not only as someone who volunteers for the foundation, for the Massage Therapy Foundation, but also as a client, a receiver of massage. So I'll be kind of mulling this over. So I appreciate that. Thank you both. Any other closing thoughts or last-minute comments?
Well, my big closing thought would be that I really recommend folks go and read this article, and don't let the methods and the big words sort of scare folks. I mean, really go and take a look at this. This is a meaningful, important article, and without sitting here and just reading it line for line and going over all of the key points, we're not going to be able to do it justice here. So please go and read this article. It's an important piece of our profession.
And reflect on how you want to model these concepts in your practice.
Yes, and why they're important. Yeah, because I think this is something that we're going to be seeing in our field, and we should be.
Yep.
Wonderful. Thank you both. Thank you so much for your time. I appreciate it. And thank you to our listeners for joining us today. If you're watching this on our website, thank you very much. Look below for a link to the article, which we encourage you to download and read, and also to subscribe to the IJTMB website if you're not already a subscriber. And also, please be aware that you can take the recording with you via podcast on Stitcher for Android or iTunes for iPhone. So you can take this with you and listen to podcasts in the car, while you're working out, while you're folding laundry, whatever, you might have some downtime where you can listen to this podcast on the go. So we appreciate that. And if you're listening to this on the go already, thank you so much. Feel free to come to our website to grab the show notes and a link to the article. So thank you so much. So Nikki, Ruth, thank you so much for your time today. As always, pleasure, and thanks everyone for joining us. We'll see you next time.
See you later.
Okay. Bye-bye.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.